Greetings, everyone. Hope you're all well and hope you continue learning and sharing insights with us as we keep on our discussions on this particular forum. So for this weekend, actually, I wasn't able to do the recording because I was away for an engagement, and actually that is what is going to inform the discussion that I'm having today. And I was tasked to talk about optimizing human resources for health. That was during the African Leadership Academy Network gathering that we had in Accra, Ghana on Saturday. So based on that, the key bit for me was to look at how do we ensure the human resources that we have in the healthcare system across Africa, and specifically in our respective countries where we have challenges in realization of universal healthcare coverage, and looking at it from the dimension of how do we strengthen the primary healthcare systems as a vehicle, as a starting point towards the realization of universal healthcare coverage. And as we look at it along the journey, along the spectrum, is the fact that we have healthcare workers who are trained and actually equipped and skilled in Africa. But upon the skilling, most and majority are actually looking at getting opportunities abroad. And with COVID-19, we've had a great actually transition where we have most of our people leaving the country, that is brain drain for the African continent in terms of healthcare workers. And when you look at the kind of opportunities they're getting abroad because of the expectation that they're going to get a better pay. So the hope of a better life, a better opportunities, better working conditions, which is what is driving that. But at the same time, as we are losing our people, we need to acknowledge that we've invested in their training, we've invested in their development. And beyond that, we also need a healthcare services in the country. So it's because we are losing our people who are able to support us in achieving our healthcare needs, and that is a loss for us. So for this thing, I think we need to ask ourselves, how do we ensure we have the best people who are actually skilled, equipped, and able to deliver on healthcare services? And beyond getting these people, then how do we develop them? Once we recruit them, how do we retain them in our facilities? And then how do we continue the journey towards achieving our universal healthcare coverage, which is in a greater perspective of looking at availability of healthcare services, accessibility, and affordability of these healthcare services. So who is going to finance such kind of interventions, and how does it happen? So on that account, then the key bit for me in terms of the discussion was I was keen on being the keen on the different components and the different phases that we need to look at when we talk about healthcare service delivery. And I've captured some of them here in terms of training, recruitment, retention, and development, and all that. But beyond that, we need to understand that when we talk about healthcare service delivery, these are encompassed within the health system building blocks by the WHO, where we have the health service delivery, the first thing, human workforce as a critical ingredient, health information management and systems, that is the digital aspect and the information being collected the best way it can be, access to essential medicines, health products and technologies, which is another bit. Then we need aspect on health governance, leadership and governance for healthcare services, and finally, the healthcare financing. So out of the 6 health system building pillars, there's none of them that has not involved human workforce. There's no way you're going to talk about leadership and governance without the leaders, without individuals leading the transition and the development of the sector. There's no way we are going to talk about health information management system if they are not people who are good in terms of data management and data systems in place. There's no way we are going to talk about financing if you don't people who are good at financial consultants who are able to look at it in terms of raising the money, resource mobilization, optimizing the prudent use of these resources. So human resources cuts across the healthcare system, building blocks and healthcare system pillars. And therefore we need to know, how do we get the best people for ourselves? The starting point at the start of it was, before I become a doctor, I have to apply to get to school, and I have to go to get the quality education that is needed. So as a continent, we need to up our game in terms of our education system. Our education system, most of it is actually anchored on the initial redefining education system that we got from our colonizers initially. For Kenya, I would say we're taking the training of medical doctors and medical pharmacists and all the healthcare workers from the benchmark that was established by the United Kingdom upon colonization of Kenya. So how far have we gone in terms of improving our training, improving our service delivery? So if the training has not evolved, then we are missing out because we're still training on what used to be, how it used to be. But that is not giving us the results because there are so many changes, there are so many dynamics of what we're dealing with. We're dealing with now new technologies and new advances all over the world. So that aspect of training has to improve. We need to get the right people into the training. What is the motivation of somebody getting into medical school? We have the different dimensions, but at the same time, we need to look at Are they meeting the initial requirements for someone who can pursue a medical course, deliver the healthcare services, and with a commitment to personal development and professional excellence at it? Because without that professional excellence and desire to achieve it, then we're not able to deliver the quality services that we do all hope for. So we need to ensure that we have the initial recruitment processes, that is the enrollment criteria in place, optimal. The training has to be evolving to the market needs beyond being the core didactic training in terms of the medical skill, medical knowledge that we need. It has to be experiential. It has to be anchored on what are the market needs, what are the gaps that we're closing out on, and how are we going to close on these. Once we're able to do that, that will be a win for us. And I believe we're at a better position to champion for such kind of evolving market-driven responsive education and training, so that somebody has the critical thinking, the capability to actually decipher what are the key nutrients, what are the problems, how do we solve them? Are we solution oriented, or are we problem focused? Are we offering healthcare services when people are sick, or are we being proactive to see how do we strengthen our healthcare system so that we prevent disease as much as possible? And that cuts across the continuum of healthcare service delivery. We're talking about promotive care, preventive care, curative, rehabilitative, and palliative care. So that is a scope of it. After the training of individuals, and we invest a lot of money in terms of work, governments financing education, individuals paying for it through their parents' money or even getting loans, which is financing that is critical for us. But after training, if we don't recruit these people into our healthcare systems, we are losing on it. And that is where now the recruitment phase has to be robust, and we have to ensure that we have the right number of healthcare workers. Currently, there's no country in Africa that has the optimal number of healthcare workers. And therefore, it means we need to up our game and employ more of them and actually deploy them where they need to be. So after recruitment, we need to deploy where they are needed. Currently, we also see the problem is that most of the trained medical workers would be keen on working within the urban metropolis, because these are sectors, actually areas where they have better working conditions compared to the remote rural communities, which is actually a pity for me, because we need more of us serving the local communities where they are, because that is where we have a bulk of our problems, and that is where we have the greatest need of healthcare service. So we need to be able to respond to those needs in those particular communities. And I believe now, because even we're having a new government coming into place and all that in Kenya after the elections, that is something that from the different professional societies, we need to engage proactively, and we need to be strategic rather than being responsive to things that we're just like saying what we need to say at a particular point in time. So we need to be strategic, we need to be deliberate, and we need to push for recruitment and deployment of healthcare workers where Kenyans or where our citizens need them to offer the quality services. Upon deployment, recruitment and deployment, we need to ask ourselves, what are the key impediments to people actually getting fulfillment out of their jobs? One, either the remuneration packages are not comparable to whatever the kind of work they're doing. That is on one end as a motivation, the salaries and the benefits that they get from that service. Beyond that, the other bit that we need to be keen about is the working conditions. If I'm coming in as a pharmacist and I don't have medicines at the pharmacy, and I'm never going to have medicines available in the system, even when I make requisitions and look at how to optimize the supply chain. So selling out of stock is not my mission. It's not what I'm trained to do. So on that account, then most of the times we'll get our healthcare workers leaving this particular workstation because they're not finding something of value to do in these facilities. And if they're not able to, then we're losing out because they're not able to use their skills and the capabilities. So that in that case, then we need to know how are we retaining them, giving them better packages in terms of remuneration packages and benefits. We need to ensure that the facilities are well equipped and well stocked in the different areas that they're needed. Do we have power supply? Do we have the IT information systems? Do we have the medical equipment that we need? Do we have the facilities that actually the movement around so that we engage the communities? Do we have the supportive leadership and governance framework that can enable the healthcare professionals and experts to be able to shape the conversation, to shape the policies, and shape the interventions in the different geographical locations where they're working? So that is a good bit that we need to ensure we retain them. And when we're retaining them, we have to be robust enough around it. So beyond the retention, the next thing is development. If I started as an undergrad pharmacist in practice, then I need to grow to be, let's say, for example, a specialist in any area, oncology, pharmacist, or anything. So if I'm going to go that direction, then the question is, are we investing in the development and specialization of our healthcare workers? And upon specialization, the other bit that we need to be keen on is, after I'm specialized, do I have an avenue where I can come back and practice? Because oftentimes we have medical doctors who are graduating, then they go and do their specialist exam, specialist training, they get a master's degree, they become consultants, senior consultants, and all that. Some even have PhDs. And upon getting these qualifications, then you realize that our health facilities are not able to offer the services that they've specialized in. They're not able because they're not equipped. And on that account, then instead of offering services, doing research, they've transitioned to the point that now they are going into academia. In academia, rather than creating new knowledge, doing the research because the research is not them, they're just regurgitating the information that they learned that they feel needs to be transferred. But the question is that is not going to help us because knowledge is not about the accumulation of knowledge. It's about the application of knowledge in solving real-time, real-life experience, real-life challenges. And that is where we need to ask ourselves, are we going to work on building our people to be able to deliver on those? So if we can work across the spectrum on the continuum of healthcare service delivery and workforce development, then beyond that, ask ourselves, how do we promote their well-being, the human dignity? And human dignity is being actually getting fulfillment from whatever I'm doing, knowing that I'm doing what is of value to the society. If we say as a healthcare worker, my mission was to contribute to human well-being and serve individuals, then I'm going to a hospital where the only thing that I do is either referring them or actually telling them I don't have the medication, then that is actually, it's a sign of incompetence on my end. I mean, inability to deliver what I say I'm supposed to. It's frustrating, it's demoralizing. And that is why we're having our people leaving. But at the same time, we also have to ask ourselves, from a geopolitical engagement, are we pushing for our agendas actually so that we can see? Because when you look at even the immigration and all that, we have healthcare workers going with ease, but then other sectors are not allowed to go as much. So are we partially good and partially not good from an African context? And how do we stamp our authority and ensure that we have a working world that is meeting the needs of every other region? And what are the benefits of this kind of immigration or immigration? So across the continuum, we need to do the work that needs to be done, but we have to capture the different areas. Let's train the right people. Upon training the right people, let's recruit them and deploy them to deliver the services. Let's equip them to be able to deliver the services by giving them the facilities they need to deliver services. Beyond that, let's retain them by actually remunerating them sufficiently and getting them the facilities they need to deliver the services. Finally, let's ensure that beyond retaining them, we are giving them room to develop and advance our healthcare systems. If that is done, we'll be in a better position. And as healthcare workers, we need to take responsibility and ask ourselves, what am I doing as David in my professional development? What am I doing to actually contribute to the advancement of the profession where I work? If I'm able to identify that, and you are able to identify that on your end and put in the work, then we'll be in a better position to shape the future of our nation. As we've had now elections done in Kenya, it's upon you to ask yourself, how are you going to work with the incoming government to ensure we're able to achieve the results that we hope for? We're able to achieve the successes that aspirations that we all have, because that is what's going to make a difference in the future of our nation. Thank you so much and have a good one. Hope we get to engage again on Sunday. I'll be around and do the video in good time. Thank you.